For this panel discussion, you will hear from each of our panellists. They'll talk for about 7 or 8 minutes and then they will take questions from the floor, so keep them coming in nice and early. Today we have, kicking off things, Associate Professor Tanya Egerton-Warburton. She is an emergency physician. She is also an Associate Professor in the School of Clinical Sciences at Monash University and the National Drug Research Institute here at Curtin University. She also sits on the Australian National Advisory Council on Alcohol and Drugs. She is also a local, born and bred in Western Australia, so it is good to have you here. You'll then hear from Professor Tanya Chikritzhs. I hope I've pronounced that correctly. She leads the Alcohol Policy Research Team at the National Drug Research Institute at Curtin University. We also have Miss Julia Stafford. She's the Executive Officer of the McCusker Centre for Action on Alcohol and Youth at Curtin University. And then you will hear from Terry Slevin, Cancer Council WA. We'll get Diana to kick off. Thank you.
Thank you. Wait for my slides to come up. Thumbs up. Thank you. I'd like to introduce you to my nephew, Robert. He lives in North Perth and he works in a suburban law firm. He and his wife, Sarah, they're not exactly what you'd call hipsters. They like to play board games and they're expecting their first child in June. This is Robert after a night out in Northbridge. He and Sarah were walking along James Street, not more than 200 metres from where we're meeting today. They were with a couple. They saw a heavily intoxicated patron leave a licensed venue. Intuitively, the group steered themselves across the road. The man followed. After telling Robert that he should shut his women up, he struck Robert in the jaw and cheek. Robert fell backwards and struck the curb. He lay there, lifeless and unconscious. Sarah thought he was dead. Police, paramedics, and what I can only describe is a wafer-thin slice of anatomical and physiological good luck. Robert woke up on the way to hospital. Emergency clinicians see these types of tragedies and near tragedies every day. We asked emergency clinicians about their experiences of alcohol-related violence. And 9 out of 10 of them, 9 out of 10 of the doctors and nurses that sign up to work in our hospitals had experienced alcohol-related violence in the last year.
I cared for a woman who was about my own age. So her husband had been hit by a drunk driver and deceased on the scene. And she was unaware of this. She asked for him repeatedly and I was there with her when they told her. So that was a particularly hard day at work.
In 2014, 2002 emergency department doctors and nurses in Australia and New Zealand responded to a survey which asked them about their experiences of alcohol-related presentations in their ED.
I was obviously pregnant. An alcohol-affected patient threatened to punch me in the stomach in front of his wife and kids.
By an intoxicated patient.
They take up a huge amount of resources, especially the trauma-related injuries, at a massive cost to the health system.
If a patient is in pain or dying, the last thing they need is yelling, abuse and swearing in the cubicle next door.
Verbal abuse is an hourly occurrence in my ED.
You only need one combative, alcohol-affected patient to completely disrupt the functioning of the department.
Abusing staff or other patients, creating a scene or generally being
I've been verbally threatened and physically assaulted, pushed, punched, spat on and bitten.
You have no idea what it is like at 2 o'clock in the morning to be telling the parents of a 22-year-old that their child is brain dead.
Dealing with intoxicated patients takes a toll on the staff. It's very tiring and emotionally draining.
Every day. And it's not just Friday night, Saturday night. It's every day.
Alcohol-related harm to our emergency departments has been underestimated by the current methods. We looked at 8 emergency departments around Australia and New Zealand 24/7. We screened over 8,000 patients, and for the first time we actually counted the people like Robert, the people that were innocent bystanders, because they don't come up in any data set. So we looked at the indirect harm, and what we found, shockingly, that was almost 9 out of 10, let me start that again. What we found that almost 10% of patients attending emergency departments around Australia were alcohol related, and this is higher than previous estimates. Dan Fadovich looked more closely at that same study at the WA cohort, and shockingly he found that 15% of ED attendances at Royal Perth Hospital throughout the week are alcohol related. That's 1 in 7. And 1 in 5 of those attendances were just like Robert, were innocent bystanders. Now, 2/3 of those presentations came from the Northbridge and the CBD area. These numbers, if you look at Australia, that equates to 500,000 attendances to our emergency departments every year. 500,000 preventable attendances to emergency departments around Australia. Now, unlike the GST, Western Australia sure gets its share of alcohol-related harm. It gets more than its fair share of alcohol-related harm. With our figures and our snapshot methodology, we would estimate that there are 100,000 attendances to West Australian emergency departments every year, 100,000 preventable attendances. Now, you can't stop this tab, but you can sure tighten it and reduce these number of tragedies that are presenting to our emergency departments, and I'm going to talk about some of the ways we can do that. Gordian Fuldy is a long-standing director of St Vincent's CD, and his research demonstrated that by instituting early closing in the Sydney central area, you can reduce these really serious assaults and injuries, these one-punch injuries, by 25%. In a study published only this week in the Medical Journal of Australia, he's shown a 10% reduction in orbital fractures from these assaults. Now, it doesn't sound like much, but it saved the healthcare system over $500,000 in 2 years. We know, and Steve talked about this, of the effect of Newcastle, but we now have compelling longitudinal and international data that demonstrates by early closing you can reduce these serious assaults and injuries. Those results, this is a very powerful study from Norway that demonstrated that policymakers can just turn on and off this alcohol-related harm by early closing. So for every hour after 1 a.m, you get a 10% increase, almost a 20% increase in alcohol-related trauma. So, and this, in Norway, they demonstrated the effect in either direction. Open the tap, an extra 20% per hour. Close the tap, reduce it. The same cities over the 10-year period. Jonathan Shepherd is a facomaxilla surgeon from Cardiff in the UK. He was sick of seeing patients with horrific facial injuries like Robert's. His Last Drinks project is a highly cost-effective community-based introduction that could be introduced easily in jurisdictions across Western Australia. What it involves is sharing data that's currently collected by police, but also the big missing data, the health data. By asking people that attend your emergency departments, is this presentation alcohol related? And more importantly, where did you have your last drinks? And Dan Fadovich asked this data, and that's why we have the compelling data about Northbridge and the CBD area. This intervention of data sharing has allowed Jonathan to form local alcohol action groups. It's doctors, it's police, it's licensing, it's transport, it's local government. Together, they use their data to identify hotspots, and then they have local solutions for those hotspots. They may be licensing solutions where people get their licence restricted. They may be phased police interventions. There may be environmental solutions, ED clinicians go to the licensed venues and share stories and photographs to the people that sold the last drinks. It's a bit like the powerfulness of Robert's story. It works. One example of an environmental solution that a local council instituted was that there was an area outside a number of licensed venues that was clearly a hotspot, many people injured in that area. They couldn't pin it down to one venue, and when they looked at it, their solution was to turn that area into a pedestrian mall after 1 a.m. Stop the drunk punters bumping into each other, stop them going to prison, stop them going to hospital. This is the compelling data from Jonathan's work, and you can see where this was introduced in 2003. This is Cardiff and this is like cities. A massive reduction in injuries and a very similar change and more powerful change to homicide. Where would you rather be? In Cardiff or in London? This intervention is highly cost effective, with savings of £85 for every pound spent on the intervention. It's now been taken up in more than 80 by more than 80% of emergency departments around the UK, and it's also been taken up internationally. So there are simple taps that policymakers can turn. Ensuring that there is early closing is such a simple intervention. If you ask, according to what Steve was saying, ask paramedics, police, emergency clinicians, what cosmopolitan things happen after 3 a.m, and you'll find that they don't see a lot of it. Collect data in your emergency departments on whether presentations are alcohol related, and importantly collect the last drinks data. Share these with local alcohol action teams and effectively reduce ED presentations as well as assaults. Now, this is Rob and Sarah. This is Christmas, and they're reading a copy of Baby Love, which I gave them because they were pregnant at the time. And they've asked me to pass on a message saying that they're really hoping that some things will come out of this summit that will result in real changes. So when their son is 18, that they'll be able to walk down James Street and have a chance of being safer than Rob was. Thank you.
Thank you I'm just having a little iPad problem there. Thank you very much. Thank you very much for that, Diana. We'll now hear from Professor Tanya Chikritzhs. She leads the Alcohol Policy Research Team at the National Drug Research Institute at Curtin University, talking about alcohol availability and why price matters.
Thank you very much. I fear that you're going to be hearing similar themes over and over again. We all seem to be very much in concordance with each other, and I feel completely surplus to requirements as well after Steve's presentation, because he's covered just about everything there was to say about our alcohol availability. Anyway, I'm going to stick very closely to my script because we don't have much time. Here we are. Oh, that's not my fault. So, shall I just zoom forward to see if it's next? Can you tap dance? Yes, I can. Well, I can start actually, because we don't need the slides for this. So I was just going to introduce you to alcohol availability, but you all know exactly what that is. So just to recap, there's two main types. Well, actually, what is alcohol availability? Really, it's how easy can you get your hands on alcohol. Two types: physical, which means how close are you to the nearest outlet? What's your age? Are you under 18? What are the trading hours of the local venue? And economic availability, which is really nifty, and that really relates to your disposable income as it relates to the price of your beverage that you're trying to purchase. And of course that's affected by, let's zoom forward now, discounting, tax, and, as we'll hear in a little bit more detail from me, minimum price. So why does availability matter? Well, it matters, frankly, because decades of scientific research evidence support the conclusion that as availability goes up, so does consumption and so do related problems. and in the reverse, as availability falls, use falls and problems decline. Now, there are levers, wonderful levers that policymakers and decision makers have at their disposal which aren't used often enough, as we heard from Steve, and I've only picked 3 because that's all I have time to talk about, and I've left off the 21, the older legal minimum drinking age, because as Steve says, it's a tough nut, that one. But the thing that gets raised a lot, particularly around liquor licensing matters, is outlet density, the placement and the number of outlets. But in truth, the relationship between outlet density and harm is much more complex than counting up numbers of outlets in an area. We really need to take into account the variability between outlets. A large discount store with huge discounting capacity, enormous numbers of brands, would have much greater influence on the purchasing habits of the local neighbourhood than, say, a small boutique bar that only sells wine. And it's also true to say, I think, that the alcohol research field, and myself included, we've overlooked and underestimated the contribution made by off-outlets. And Steve mentioned pre-drinking, and we have some evidence now that a lot of the harm that occurs at on-premises, like bars, pubs, nightclubs, is related to people who purchased cheap alcohol at an off-outlet and drank to intoxication before they even went out. So dealing with all of this variability requires modelling, and it requires the best data possible, and Diana talked about that. It requires data on the outlets themselves, sales data, and it requires the harm data, all to be linked together and stuck into lovely models. Trading hours. Some of the strongest evidence around restricting trading hours actually comes from Australia and Perth, and as you've seen, Newcastle as well. And basically they show, you've heard this, that when trading hours are longer, we get increased harms related to intoxication, like violence and drink driver road crashes. When you reduce those trading hours, we get fewer problems. But extended trading hours, not to be confused with lockouts, which are a different kettle of fish. And I think actually Diana has a new paper on that. I might be right, yes. But we're not going to cover that right now. Next, price, zooming along, is an extremely powerful lever. The evidence for price effects, there's over 130 papers around this. It mostly relates to taxation impacts, but we know that a 10% increase paid by consumers leads on average to a 5% reduction in consumption. Not just for, and it includes everybody. That includes heavy drinkers and young drinkers, problem drinkers, and what follows, of course, is a reduction in alcohol-related injuries and illnesses. Now, alcohol taxation is behind most of these studies, and it's a common means of adjusting price, but there is a new kid on the block, and we've talked about it. It can either be used as a standalone strategy or one that complements policies such as volumetric taxation. And by the way, volumetric taxation is not something we currently have in Australia, but this is clearly the domain of the feds and not something we can actually influence here at a discussion about state-based controls, but certainly something worth considering. But what I'm talking about is minimum pricing, MUP, we call it. A very hot topic. We've all heard about the Northern Territory looking to introduce a $1.30 minimum unit price soon. I'm not sure about the timeline. So what is MUP? Quite simply, it's where the government sets a minimum price below which alcohol cannot be sold at retail. The effect on the retail price of different beverages depends very much on where the floor price is set, but it always affects the cheapest beverages first, which is extremely handy from a public health point of view because these are the same beverages which attract the heaviest drinkers. So let's have a look at why that is. On the left here, we can see current prices. I just took these from various websites. And we can see that they're sort of arranged in increasing price per standard drink. Cask wine is at the bottom. Clean Skins is actually not much far ahead either in terms of price per unit, price per standard drink. We can see that if we introduced a $1.30 minimum unit price, the price of all these wine-based beverages would go up, but the beer and the spirits and the cider wouldn't be affected because they're already sitting at $1.30 on average per standard drink. On the other hand, if we chose to do $1.50, we then managed to include beer and spirits, but not nearly as much as cask wine, which would be going up by about 5 times the price. of course, keep in mind that the reason why wine is such a great candidate for influencing with MUP is because it receives the wine, it's affected by the wine equalisation tax. It's treated much more kindly by the tax system than all the other beverages. And I suspect that if the federal government removed the wine equalisation tax tomorrow, this table would look very different. Right. So actually I've gotten ahead of myself. So why is MUP a good idea? Well, it's a good idea precisely because it increases the retail price of the cheapest beverages but leaves basically the others unaffected. So it actually has a very targeted action on the heaviest drinkers who prefer to spend less per standard drink, and it leaves the majority largely alone at small effects. But for the same reason it affects lower priced beverages, minimum unit price is often subject to the counter-argument that it penalises the poor. So let's take a look. I borrowed this figure from my colleagues at Sheffield University in the UK, where they've done some absolutely fantastic work modelling hypothetical MUPs on the UK population. And this one basically, shows us, what would happen. So the hypothetical is 45p, so a standard drink set at 45p, which I'm guessing is less than $1 Australian, maybe about 90 cents, right? And it's showing the extent to which different segments of the population, different levels of drinkers with different types of income, already purchase at below this minimum price, right? So we can see these green folks in here. These are the vast majority of us who drink at moderate levels. Very few of us actually purchase much at all that's under a minimum unit price of 45p. But by comparison, you can see that the harmful drinkers are purchasing very large quantities of their overall consumption under the minimum unit price. So these people, especially the ones in the low income column, are mostly affected by that minimum unit price. Now, clearly, there is something going on here in relation to income. Having said that, if you model what this reduction in consumption from minimum unit price would produce, the estimates are that these heavy drinkers in the lowest income area would drink up to 30 bottles of wine less a year. And the higher income heavy drinkers more like 3.5 bottles of wine because they can better absorb the price increase because they're on higher incomes. And even though this looks like an unfair approach which would affect the poor the most, the vast majority of the benefits of this MUP will actually accrue to this very group. So they actually receive 80% of the benefit of the reduction of deaths, hospitalisations and improvement in quality of life accrues to this very group. So it's not actually as regressive as some would argue. Recommendations. My recommendations, in a nutshell, use local level data to model effective evidence-based responses to liquor licensing matters. And as Steve said, give the community a better go at having a bash at being involved. It's pretty tough for communities to get involved in liquor licensing matters. Resist lengthening standard trading hours. Late trading permits really should be seen as a privilege rather than a right, and they should be shut down when problems occur. But to know that, you need to monitor. And introduce minimum unit pricing with regular adjustments for inflation. And I've added here that we should consider the feasibility of coupling that with a public health and safety charge. I'm not going to call it a levy or a tax because that's federal domain. But one of the problems with MUP is that the generation of the extra money spent doesn't actually accrue to the Treasury. It goes to the liquor industry. And it's not as much as you might think. But it would be nice to know that some of that windfall would be going back into treatment and prevention services. And one last thing I'll leave you with is that MUP is not necessarily a competitor or should be used in place of a volumetric tax. They actually complement each other beautifully. And if we could do both, if we get the feds to line up with the state, that would be fantastic. Thank you.
Thank you very much, Professor Tanya Chikritzhs. Getting the federal government and the state government to line up is wishful thinking, I think, on many issues, but who knows. Let's now hear from Julia Stafford. She's the Executive Officer of the McCusker Centre for Action on Alcohol and Youth at Curtin University.
Thank you. Well, for those working to prevent harms from alcohol among young people, reports of encouraging reductions in young people's drinking are welcome. Our challenge is to avoid complacency and to keep these trends moving in the right direction. The impacts of alcohol on WA children and young people continue to be of major concern. And these concerns centre on the many and varied harms young people experience from their own drinking and from the drinking of others. These include damage to the developing brain, the lasting impacts of fetal alcohol spectrum disorders, violence and family violence, injuries, drink driving and road crashes, and the list goes on. These are not problems without solutions, and many of the evidence-based approaches to reducing harms among young people will have positive flow-on effects across the community. And as we've heard today, a comprehensive approach is essential. There are no magic bullets. An important approach Tanya's just talked about is minimum pricing of alcohol. We know young people are particularly sensitive to the price of alcohol, and that changes in alcohol prices are related to changes in young people's drinking. Setting an appropriate floor price per standard drink will tackle the unreasonably cheap products and the heavy discounting we see from the big retailers. This policy should also ensure access to support services for those most affected. From the perspective of preventing harm from alcohol among young people, there is a strong basis to support a minimum price on alcohol in WA and to support action nationally to reform the alcohol tax system, particularly to remove and replace the wine equalisation tax. West Australian children continue to be exposed to masses of alcohol promotion in many forms. This is a problem. Systematic reviews of longitudinal studies show that exposure to alcohol advertising influences young people's beliefs and attitudes about drinking and increases the likelihood that they will start drinking or will drink more if they're already using alcohol. This is why the WA government's commitment to remove alcohol advertising from Transperth buses, bus stops and train stations is so important. We support action to implement this commitment in full and as soon as possible. To complement this nationally, it's time to end the charade of industry self-regulation under the ABAC scheme and other weak industry codes. For too long, the ABAC scheme has protected the alcohol industry from effective regulation rather than protected young people from exposure to alcohol ads. Try to argue that these alcohol ads don't target young women. If governments are serious about acting on FASD, acting to prevent FASD, governments need to get serious about regulating alcohol promotion. When a spirits ad telling you to party like it's payday can be placed outside a WA Perth Centrelink office without breaking any alcohol advertising rules, there's something seriously wrong with the rules. Legislated controls would also end the baffling loophole that allows commercial TV to show alcohol ads during sport in kids' weekend viewing times. In an effective system, regulation would be independent of commercial interests. It would start with a genuine motivation to protect children and young people and other vulnerable groups. It would cover all forms of alcohol marketing, and it would monitor compliance and penalise breaches. None of those things happen under the current system. By reducing the volume of competing marketing messages, harm reduction campaigns would also have greater cut-through. WA can be proud to be a national leader in alcohol public education campaigns. The Alcohol Think Again program is the only long-term, evidence-based program in Australia to raise awareness of the risks associated with alcohol and how to minimise your risks. The Alcohol Think Again campaign support parents to reduce the risks of alcohol-related harm for their children. They raise awareness of the importance of no alcohol during pregnancy and the other low-risk drinking guidelines. They ensure culturally secure messages for Aboriginal families and communities, supported by the Strong Spirit, Strong Mind and Strong Spirit, Strong Future programs. And they build knowledge around the longer-term risks of drinking. Maintaining adequate investment in these comprehensive campaigns is essential to continue their positive impacts. The messages young people receive through schools are also really important. Well-supported alcohol and other drug education should be mandatory within the school curriculum. School staff should be supported to deliver comprehensive alcohol education with appropriate training, professional development and high-quality resources. Parents should be entitled to expect that their children will be provided with quality education which gives sufficient emphasis to alcohol issues. And to the issue of underage access to alcohol, WA's liquor laws very appropriately prohibit the sale or supply of alcohol to minors on licensed premises, but there is currently no effective means to monitor and enforce that part of the law. Voluntary retailer policies about asking for ID are not enough. We know many young people find it easy to buy alcohol. Police and other regulators need the appropriate tools to test compliance. Controlled purchase operations are one model. Trained underage volunteers visit licensed premises under police or other regulators' supervision and attempt to buy alcohol, following clear and strict guidelines. If they're successful in buying the alcohol, the accompanying police respond appropriately, particularly with a warning in the first instance. This type of monitoring can be used in Western Australia to monitor tobacco sales compliance, but currently not for alcohol. Community surveys show strong public support for this measure, and we hope that it will be seriously considered in the next stage of amendments to the Liquor Control Act. Thank you.
Thank you. Thank you very much to Julia Stafford. Our last speaker, Terry Slevin from the Cancer Council of WA.
All very tired, so please stand up, stretch, wake up, big deep breath. Thank you very much for getting some water while I'm talking. Very good news. Now, I'm here to talk about the Australian alcohol, the drinking culture. That's the problem. That's what's causing all of this. The Australian drinking problem, the Australian drinking culture. That's our problem, it seems. Well, let's see if we can figure out what that really is about. I thought I'd find out what that actually means. I'm trying to figure out which button to push here, and I'll go with that one. And what's the font of all knowledge these days but Wikipedia? So Wikipedia tells me what the Australian drinking culture is, and it tells me that the Australian drinking culture involves alcohol for celebration, for social activities and for relaxation, but it's also an important revenue generator. It's also important for employment, and it's also important for export. So there's clearly an economic component to this game. But we also know that the Australian drinking culture involves drinking to get drunk. That's the objective. We've all heard it. But that results in 42 million incidents of binge drinking each year. I'm going to say that again. 42 million incidents of binge drinking each year in Australia. And what are the driving forces? Social customs, as I've already mentioned, habits, publicised images and normality. And how do we determine normality? It doesn't come out of the ground. It doesn't blow in on the sea breeze. It's not emanating from the Pindan folks. This is carefully and deliberately generated. We've heard a lot of talk about the influence of availability. We've heard about pre-drinking, and we've heard about the fact that intoxication is not only common, but it's accepted and even encouraged. So if that's the Australian drinking culture, the fair question to ask is, how is it created? Before I answer that question, however, I'll simply point out, why do I care? I care certainly about the immediate adverse effects, because that affects my family, and my son's been attacked in Northbridge. But I also care about the long-term chronic effects. Only this week, Tanya's group released a bulletin articulating the long-term effects of alcohol consumption, therefore alcohol-related harm, and cancer is being amongst them. So 12,800 hospitalisations each year in Australia as a result of alcohol through the prism of cancer. 2,103 deaths, cancer deaths attributable to alcohol consumption. And recent data we've collected suggested that we're starting to get, as a result of the campaigns that have been run, that message through that there is a link between alcohol and cancer, and we're leading on that front, I'll let you know. But at the same time, the same survey tells me that 1/4 of our respondents think red wine prevents cancer. Another 50% either don't know or think there's no effect. So we've still got a way to go. So what creates this alcohol culture of ours? And when should we drink, for example? Simple question, when should we drink? Well, of course we should drink at the cricket, and good luck to the boys with 5 for 200 odd overnight in South Africa. But of course they're going to be wearing VB, and of course there's going to be a wine sponsor associated with it, and I suspect with their South African friends as well. And guess what? The Big Bash map tells us every team, but every alcohol brand that's linked with every team in the Big Bash. But also we should drink when we win the cricket. We should drink on Australia Day. Not just on Australia Day, on the entire long weekend. We should drink on Father's Day. We should drink on Mother's Day. We should drink on Valentine's Day. We should drink at the weekend when we're brewing up our skin cancers. We should be drinking at the beach. We should be drinking any time, and we should never refuse a drink. Is this drinking culture of ours something that comes out of the ground? No. It's deliberately, carefully, ruthlessly created by the people who sell the product. And guess what? You can drink on Friday, you can drink on the great Aussie Sickie, you can drink on payday, you should celebrate a win, any win, and you should drink anywhere. Gee, where does this Australian drinking culture come from? But hang on, alcohol, think again. So what are the solutions? The first one, you won't be surprised to hear me say, is about marketing. Firstly, marketing restrictions. Shall we take our foot off this accelerator? When we have a look at the figures and we see self-regulation, Julia made reference to our friends at ABAC, self-regulation, the voluntary industry-run code that's meant to control alcohol marketing in this country, is little more than a joke. We have got the keys to the blood bank in the hands of Dracula, and we let it happen. We just let it happen. That is madness. Self-regulation, ladies and gentlemen, you won't be surprised to learn, in my view, is no regulation, and we've seen it play out time and time and time again. You want the evidence? Ask, we'll back up the truck. Secondly, counter-advertising. In this environment, this sea of marketing that we're all exposed to, whether our kids are exposed to, yes, it's time we put on the brake a little bit. And it is worth recognising and acknowledging that the work of Tim's team at the Mental Health Commission with the Alcohol and Think Again and earlier iterations of that campaign is world leading, and I can give you the evidence of the effectiveness of it. People around the world look to that campaign. We need to make sure it's well supported in an ongoing way and persistent. This doesn't get fixed overnight. Second one, liquor licensing, and over the last fortnight in this state we've heard a lot of talk about this. But it's not unreasonable to simply point out that the laws codify and reflect and determine our culture. The rules set by our lawmakers are the ones that we allow to occur through our democratic process. And the recent relaxation of the Liquor Licensing Act in this state, and make no mistake, that's exactly what it is, there will be an increase in liquor licence holders in this state. There will be an increase in the number of places where people can buy alcohol. That means there'll be more people selling more product. For them to profit, for it to work in a business sense, guess what? They need to sell more booze. Does more outlets result in changing our culture? Does anybody genuinely believe that we will change our culture as a result of having more alcohol retailers available? I don't. But Roger, that ship has sailed. That decision has been made and it's been announced. The one thing that can be done at this point, The one thing as a voter I demand at this point as we measure the effect of that. We want to know what's going to happen. Get the data. Find out what the current circumstances here are now. Let's find out what the impact is in 3 years, in 5 years, when you're still sitting at the cabinet table and the review comes up. Let's judge it on the effect. Let's get some evidence, let's get some proof and have that as part of a legitimate policy debate. Human society has been debating the constrictions and controls on alcohol since time immemorial. There is evidence in Roman and Greek times of this public debate. Steve rightly articulated the benefits associated with alcohol consumption that societies enjoy. Those are right to be recognised. But there are rules, and every society forms rules as to how do we curb and control the harm. That means we have to persist in contributing to that debate, not turning a blind eye and allowing these changes to go through unquestioned and unchallenged. And the way we do it is not by telling stories, not by making up fairy tales, but by providing good evidence. Finally, we've heard about tax, and price matters a lot. Volumetric tax is without doubt the best tool in the Australian government. And this actually only came out yesterday. Peter Martin published in the Fairfax media. And there is some really fascinating data there. What he talks about is the Australian tax collection fell by 0.7% in the last period compared to the previous budget period. The total tax collection grew by 5.2%. The economy grew by 5.7%. Consumption of alcohol grew by 2.4%. Alcohol taxes shrunk as a share of GDP relative to the size of the economy in 2006-07 without that shrinkage and the alcohol tax collected, the Australian budget would be $1.4 billion better off. This is a submission put into the Treasury in January of this year by a former Treasury official. New South Wales Audit Office put their costs of that state for government services for alcohol abuse at $1 billion a year, or $416 per household. The volumetric tax at a national level, Minister, is worth fighting for. And someone needs to step up and have that fight. Every tax review that Australia has ever done has said the alcohol tax system in this country is broken. That is without doubt the fact. Let's fix it. And finally, the one tool that's available at the state government level when it comes to pricing is the floor price. You've heard Tanya articulate the case. The recommendation of the Northern Territory was for $1.50. What they adopted was $1.30. I suspect it's a political process of what the government thinks it can get away with. Let's aim for $1.50 in Western Australia, because that's what the evidence says. And note, this is not a tax. This is more money going into the pocket of the retailers. This is not a tax. It's more money going into the pockets of the retailer. The industry benefits from this floor price. That's okay. I'll wear that as long as the community benefits and the evidence is there that they will. Thank you.
Thanks, Terry. Terry, I just wanted to very quickly pick up on a point you were talking there about our drinking culture, and I wonder how many people here have been to a party and watched somebody refuse a drink being offered to them and say, no, I don't drink, and they all get looked at like they've got about 4 heads.
Nadia, try dry July. Every single person in this room should go off alcohol for 1 month and have that social experiment for themselves. Absolutely opened up my eyes. Thank you very much, Marissa. And it's absolutely true. It's an extraordinary experience when you actually stop drinking and you find people feeling uncomfortable at the fact that you've refused a drink. And I think in many cases I read behind their eyes, what does that mean? Does that mean I'm having a drinking problem? It's a fascinating experiment.
But generally I think those people are looking going, what's wrong with you? You don't want to drink?
Sure, and you get that feeling as well, but it's a really great experience to have.
Yeah. Look, thank you very much. Let's get to your questions, picking up on quite a few points that you have all raised, and I'll just get whoever wants to jump in on this one. Norway banned all alcohol advertising in the mid-1970s. Could we ever see such a move in Australia?
Sure, let's do it. Hey.
Well, there's a lot more that could be done than is currently being done to regulate alcohol marketing. And
we talk about really seriously protecting young people from alcohol marketing. There is an enormous evidence base to support doing that. And so I think that's the strongest direction that we need to move in, take it out of the hands of industry and seriously protect young people.
So where would you start though? Is it the TV ads during sport or kids, or the examples of where you actually place these ads in the community?
The regulations need to cut across all of those forms. What has happened is little bits of different codes tackle little bits of different types of advertising, and that's not working. We need an approach that cuts across all of the forms of marketing, even the ones that that advertisers haven't considered yet. You know, the world of advertising is changing constantly, and we need to get ahead of that rather than trying to play catch up.
So legislation?
Absolutely, legislation.
Okay.
And enforce legislation. And on that enforcement point, one of the debates we were having earlier in the week was the enforcement of the existing Liquor Licensing Act. I couldn't get data on the number of licensees who were prosecuted for selling alcohol to minors or to selling alcohol to intoxicated people. Why? Why is that not publicly available? And when it is enforced, my understanding is, I'm happy to be proven wrong, that the person who's charged is the drinker, not the seller. Who here has had children or themselves worked in hospitality? My hand is up, and I'm sure there are others in the room. Who here has heard that when they, as a result of responsible service of alcohol training, have suggested they should stop serving people who are intoxicated, and then been told by their manager, you keep serving because that's how we make our money? Real problem.
Okay. Diana, this is probably one for you. The ER data linking alcohol and assaults do they relate to drunk patients or patients who have consumed any alcohol in a certain period?
It really, it is the breadth of alcohol-related harm. So it's only a very small proportion of people that there are some incidentals, so have drunken alcohol, but it's unrelated. But that proportion is very small.
All right. There's a couple of questions. Darren, you're being very persistent, so I'm going to ask you a question. Thank you. Darren wants to know about if you put in a minimum price for alcohol, is there any evidence to suggest that it would just drive that business online, that people would buy more alcohol online and somehow avoid paying extra?
Well, any alcohol sold in Australia retail would be subject to the minimum unit price rule. So buying it online wouldn't get you around it.
It wouldn't make any difference where else, if you were buying it from interstate or... Yeah.
Well, the whole... I guess that's actually a point, I suppose, if you can buy it interstate. Yeah, well, we need some regulation around that. It's a tricky one.
I think with the bulk of alcohol, any cartage costs would make that sort of... I think most wine sales are
Steve
local.
might be an expert in this, actually. You've got a wine cellar, haven't you, Steve?
Hospital bars.
South Australian wine, anyone?
What about the role for more intensive interventions and regulations in geographic hotspots for alcohol use and harm, like reducing takeaway alcohol sales? And we've certainly seen those battles in quite a few suburbs around Perth recently, where there has been a particular big liquor barn try to open up and there's 3 or 4, places within a K or two. What role at that local level is there?
I think it's really important that everyone, both the community has the power, and that Steve's comments about reducing the red tape for communities to have influence on these events. We know these liquor bans directly are associated with family violence and harm, and so we should be able to influence that. And part of this Last Drinks project that I was talking about is part of having liquor licensing involved. So recognising those hotspots and then coming up with a local solution for that. So that might be either licensed venues or take-out venues.
We've seen some really wonderful examples of community members and communities coming together to oppose some of these, particularly liquor retailers coming into communities that already have a lot of liquor outlets, and that's wonderful, and it's really great to see, but I don't think it's representative of the broader challenges that community members face in having a voice and being represented on liquor licensing issues. It is incredibly difficult. We find it hard as an NGO to participate, to get the right information and data that's local enough, that's specific enough to that the exact type of licence that they're trying to create. It is enormously difficult. It's legalistic. We get the lawyers of the applicants calling us up. We hear examples of lawyers of applicants calling up community members. It's intimidating, and they shouldn't have to go through those challenges, and most don't. I mean, it's hard enough to even find out that there's going to be that there's a licence application in your community, and there are barriers all along that process. And we really need the people. The government needs to look at all of those challenges that community members face and address them if we're really going to get proper community representation.
A quick observation, that is the reality of debates in relation to liquor licences are primarily within the industry. It's players within the industry objecting to new licensees coming in to cut their lunch. Essentially, it's a fight over a slice of the pie. So there's an enormous investment. There are specialist liquor licensing lawyers who act on behalf of one licence owner or a potentially new licence owner. So it's contested as a commercial debate. And in that fight, the community absolutely comes a very, very bad last.
So how do you get the community more involved? Because generally now it's at a local government level, isn't it? It's at their local councils where they'll oppose these kind of, another Dan Murphy's or whatever.
We need to look at the whole liquor licensing process. Local governments, councils have a role, but they have a limited role as well.
And it's usually where one of the few places the community can go.
Yes, and local governments, some are doing a great job. City of Belmont are really engaged in this at the moment, and it's great to see local governments having a voice, identifying when their community has enough alcohol and saying, seriously, let's not have another outlet. But they need to look across that whole liquor licensing process to what those barriers are and addressing them comprehensively. Don't leave it up to local governments. They've already got a lot to handle and they need to have a voice in this, but it shouldn't just be up to them.
And unfortunately, this government has just given a greater say to the tourism sector on those decisions. That's what's just happened.
Tanya?
Yeah, well, I was relating this back to the interest in minimum unit pricing, because this is, if it was something that was put across the whole state, obviously it would be, then it could, quite easily suck the wind out of the sails of a lot of these very large off-site liquor store types, which are, which local communities are very worried about. And it could be, we've seen plenty of examples. Actually, the Northern Territory really leads the way in that regard as well. Before the Northern Territory government decided on this minimum unit pricing, it was actually being done voluntarily in some parts of Alice Springs. At a low level, I think it was only $1, but it was a really good start, and it can be done. If they can do it in the Northern Territory, we can do it here, surely. But I just thought, there's been some wonderful examples of where communities get behind a change when it's driven by a community and there's all the support in there. They can make enormous inroads into alcohol-related harm. We've seen it in communities that are extremely challenged by alcohol issues, and it can just turn things around. But having the backing of the community is very powerful when they get support.
This question, there's an acronym now. AOD prevention is fragmented in WA. It is often misunderstood and ad hoc. Time for that comprehensive approach to be developed. How should this be done? What does AOD stand for?
Alcohol and other drugs.
Thank you.
Well, a part of the answer is part of a discussion I was having at morning tea, and that is we've just heard the Sustainable Health Review interim report come down, and it talks about the fact that the health budget is represented 2.7% being invested in prevention. And I was tweaking a few tales about the extent to which we could actually address that. Some of those additional investments in prevention can help to address these problems. For us to pretend that we can do these things on the smell of an oily rag or hope that it comes out of the spare time of members of the community is simply unrealistic. I am in absolute awe of people who have the energy and time to devote in these kind of community campaigns. But some resources at a local government level, even area health service level, to allow people to get guidance as to how they can mount their complaints and the kind of process they need to deal with. Some assistance to do those kind of things takes resources. And it seems to me that's a legitimate investment for an expansion in the investment in prevention to allow these kind of decisions to be made through the prism of health.
All right, let's move on to this question here. Really interesting about bringing parents and carers into this equation. Now, lots of proposed strategies we're hearing today, but what about someone else doing it to us? What about with us? What role parents and carers?
I think that kind of goes back to the discussion we're having about giving people a chance to actually have a say and helping them, giving them tools to do that. I was involved in, a long time ago, a little thing called the Alcohol Advisory Council, and we tried to develop a toolkit for people who actually wanted to take some action and have some influence on these kind of liquor licensing decisions. But as Julia rightly pointed out, how do you know if there's going to be a new liquor store applied for around your quarter? How do you find that out? How do you get access to that information? And if you do and you don't like it and you talk to your neighbours and you think it's going to result in more alcohol-related harm in your backyard, what power do you have? So there are things that have been done in the past, but far too under-resourced to help people in those kind of circumstances to respond. I'm not quite sure if that's an answer to that person's question, but when it comes to parental involvement, anybody who's had kids has an absolute knot in their guts about how their kids are going to deal with growing up in this society when it comes to alcohol.
Diana, the people you see and you treat, I wonder, parents, what's the reaction when they come into the ED and their child has injured themselves through excessive drinking? Are they actually aware of their child's drinking habits? How do they react, and how much do they know about what their kids are doing?
I think the responsible serving of alcohol, which is now in all jurisdictions around Australia, is really important to educate parents about, because often we have parents bring in children and adolescents who have been at a party and they've been supervised by an adult, and they don't actually know that they have actually broken the law by serving these children or adolescents alcohol, and the huge impact it can have. So I think that more awareness around parental responsibility is really, really important. And I think part of the other thing that the College for Emergency Medicine has called for is screening and brief intervention in emergency departments for people that present with risky drinking. And a group that's really important to screen is the adolescents, to determine what their level of drinking and other drug use is. And it's a real opportunity to intervene. We've done some research around the idea of the teachable moment, and if the young person can relate the drinking to why they presented, it's a very powerful opportunity to intervene. But really, ED clinicians at the moment are swamped by acute care responsibilities, so trying to introduce these brief interventions without additional resources is hard.
I'd just like to add, it's a really good point you make, Diana, about secondary supply legislation and the importance of people being aware of that, and the idea that, mums and dads supervising children's parties, and I've supervised one myself in the not too recent past with 60 13-year-olds, which is quite a challenge, is doing the right thing, being aware of your requirements under the law now, but also, if I can be a little bit more ruthless about it, teach by example. So, the kids are watching you. What are you doing at the party? Are you standing around supervising drinking? Almost likely, highly likely, I'd suggest. And the kids see you. It's really one of the most protective things you can do as a parent is actually, at least if there are two of you, have one of you who's close to being a non-drinker. So you're setting an example that you don't need to have alcohol at every situation, at every meeting, at every party, at every joining, every time the friends come over.
I think another area that's really important is schools and school functions. And there are a lot of schools that have alcohol served at school functions and fundraisers related to alcohol. And I think that's an opportunity for government to intervene. In the similar, you shouldn't have it being advertised on your buses and you shouldn't have it served at school functions.
School ball is an extraordinary cultural experience. Everybody who's had a kid finishing high school has gone through the school ball experience and the debates as to whether alcohol should be a part of it. I, at my son's school, had to simply say, it's kind of against the law. Actually, it's not kind of, it's against the law for 17-year-olds to be drinking. Now we've got a situation where there's some 17, some 18, still mostly underage. But I still hear people talk about that debate, and it is an absolute cultural touch point that why are we reluctant to say the law says you can't drink at 18, so you're not 18, so you're not allowed to drink. It has to be as simple as that, but it's still an argument. That tells us something.
There'll always be a parent that'll put their hand up and say, yep, pre-ball party at my house and after ball party at mine where there will be alcohol.
Exactly.
And you mentioned schools, and that would probably be not hard to control, have those regulations in place, no alcohol, but it's the junior sporting community as well. And, I've got to say, when my son was playing Friday night cricket, every mum rocked up with a bottle of champagne and some nibblies, and that became a weekly social event. And that is a harder thing to control, and the message probably even stronger there, isn't it?
Theme for future Alcohol Think Again campaigns. And it is an illustration of the kind of challenges we face. These are cultural things, and we've got to push back on that extraordinary array of opportunities that the industry presents to us as the norm for drinking.
So what do? Ban alcohol being brought to these, sporting events?
You be brave about having these conversations. You run campaigns that are risky, that risk heads of agencies getting complaint phone calls. You run campaigns that risk ministers getting complaint phone calls because you're running too hard, but you create a debate in the community that allows people to actually express the view, because often the person who wants the responsible thing doesn't want to feel like the wowser, doesn't want to feel like the person who's being hard-nosed. But if you create a public debate on that front, that's where communities shift, small steps at a time. Absolutely ruthless persistence is essential, but good evidence and taking risks with your campaigns.
I've got time for one more quick question, and an interesting one. How do we help newly arrived Australian communities with little or no contact with alcohol deal with their children's drinking, people like Muslims, Buddhists, Orthodox Christians?
I think it's a really interesting question, and it's not something I know a lot about, but I think perhaps we need to talk a bit more with the groups who work directly with people who've arrived in Australia and check what information they are or could be providing. And we have the great information through the Alcohol Think Again program. There's great information for parents about young people and alcohol. So perhaps there's opportunities there, but I need to find out what's happening.
I would also be reversing this, because I think it's really what you're talking about in terms of changing Australia's culture around its relationship with alcohol. So we did one of our national snapshots on Australia Day to highlight the issues of the cultural relationship between alcohol and Australia Day and what it means to be an Australian. It shouldn't mean, it shouldn't be our national day of going out, getting drunk, injuring yourself and someone else and ending up in the emergency department.
Can I very quickly point out that it should be said today, and it's really important for it to be said today, amongst communities within Australia, Aboriginal population in Australia have a much higher proportion of non-drinkers than most other communities in Australia. And yet it's far too often we see a depiction of alcohol-related problems being sheeted home to the Aboriginal population. It is wrong, it is unfair, and it's a disgrace. So supporting people like Aboriginal communities who fight for having alcohol-free communities or places where they can safely operate in the absence of alcohol is a really fundamental human right we should fight for.
Thank you. Thank you, and thank you very much to our panel. We have come to the end of this session. Please thank Associate Professor Diana Egerton-Warburton, Professor Tanya Chikritzhs, Julia Stafford and Terry Slevin.